Following hematogenous seeding of the pericardium, there are four pathological stages that follow. The first is the serous effusion. A fibrinous exudate develops within the pericardium. It contains a large number of neutrophils and relatively abundant bacteria with loosely formed granulomas. Um, Typically, this is a subclinical stage of the disease, and patients are rarely identified at a point where they have a serous infusion only. The reason to remember this is if you do pericardiocentesis for a patient and you see that the pericardial fluid has predominantly neutrophils, have a high index of suspicion that the diagnosis is more likely to be purulent pericarditis versus tuberculous pericarditis. The second stage is the serous sanguineous effusion. At this stage, the exudate in the pericardium increases in volume and becomes serous sanguineous, in other words, blood tinged. And the cells shift from predominantly being neutrophils to predominantly being lymphocytes and monocytes. Typically, this is the first clinically recognizable phase of the disease. In addition to seeing a high white blood cell count after pericardiocentesis, you will also see a pericardial effusion with a very high protein count at this point. Without treatment, the effusion will resorb in about 50% of cases, and those people will then progress onto stage 3. Stage 3 of the disease is known as fibrosis. This is when the pericardial effusion is absorbed and the pericardium thickens. Formation of granulomas as well continues. The last stage of TB pericarditis is stage 4, and that is of constrictive pericarditis. The thickened pericardium becomes deposited with calcium, scarring occurs, and this is the final stage of the disease. The pathologic stages of the disease are important because they explain the clinical manifestations of the disease. There are 3 clinical forms of the disease. The first being the effusive pericarditis. This is when patients typically present in stage 2 of the disease, where pericardial effusion will be blood tinged with a predominant lymphocyte and monocyte leukocytosis. There's the effusive constrictive stage, form of the disease, which is when patients get stuck in stage 2, but at the same time progress to stage 4. We'll talk more about these patients in the next slide. And lastly, the constrictive pericarditis, which is what happens when TB pericarditis goes untreated until the 4th stage. Patients in this stage will have symptoms of constrictive pericarditis, such as leg edema, ascites, possibly congested liver, and low exercise tolerance, but will no longer have any evidence of pericardial effusion present on echocardiogram. Constrictive pericarditis is found in about 15% of patients at diagnosis and complicates up to 20% of cases of TB pericarditis despite anti-TB chemotherapy.